with a history of cough and sputum, with right side weakness in the body, and the patient age is 58 years, male. And here we can see in the apical segment of right upper lobe there is a cavitatory lesion with internal stents within the cavitatory lesion, and surrounding ground glass opacification, consolidation and ground glass opacification, likely corresponding towards the bird nest appearance of mucormycosis. MRI brain of same patient was also done. Here in MRI brain we can see there is T2 hyperintense lesion with peripherally thick walls and surrounding edema. In right posterior parieto-occipital lesion causing mass effect and midline shift. On post-contrast study, this lesion appears shows peripheral limb-like enhancement with internal thick septa, enhancing septa, and on spectroscopy here we can see the lipid lactate peak. This is the lipid lactate peak corresponding to its cerebral abscess, likely fungal.